British Columbia's top doctor is defending her decision to extend the time between first and second vaccine doses to up to 4 months, 16 weeks, the longest interval between COVID-19 vaccines in Canada. The move did spark some backlash yesterday, but it appears that other provincial leaders may want to follow BC's example. Michael Serapio is here on this. Michael, we were talking about this extensively yesterday. Obviously, the story has moved. So this morning, as we begin our day, what's the latest from Dr. Bonnie Henry?
Well, after getting all that pushback, Heather, on her decision to delay first and second dose of these COVID vaccines, Dr. Henry, well, essentially she's doing some pushback of her own now, saying she's very confident of her decision, confident it will save lives, and confident it will allow her province to reopen quicker and move beyond restrictions that people have been living with for nearly a year now. Now, all this does stem from Monday's announcement that BC would be extending the interval to upwards of 4 months between first and second dose. That is well beyond the 3 to 4 weeks suggested for the Pfizer and Moderna vaccines, well beyond the 12 weeks suggested for the AstraZeneca vaccine. It is the longest interval in the country, with Quebec coming now in second, as it had already announced that dosing would be separated by upwards of 90 days. But BC's interval is now about 120 days. Again, something that Dr. Henry is defending. In fact, take a listen to what she had to say.
I am so confident that the decision we made over this past weekend to extend that interval is the best one based on all of the science and the data that we have to maximize the benefit to everybody. It is a little bit unfortunate that the National Science Advisor, who obviously was not involved in some of these discussions and decision making, and perhaps didn't understand the context that this decision was made in.
Now, that last part of Dr. Henry's comment addressing Canada's Chief Science Advisor, who said what BC is doing amounts to a population experiment, and went on to say that it would be best to follow the drug maker's original guidelines, something backed by both Pfizer and Moderna themselves. But an attempt to get more shots into more arms as quickly as possible is what BC is going to do, with Dr. Henry saying, Heather, that every eligible adult in British Columbia should be able to receive a first dose of a COVID-19 vaccine by late July, based on the addition of AstraZeneca and the decision to delay first and second doses.
Her confidence was clear in that comment, Michael, as we heard in the briefing yesterday. Other provincial health officials look to be comfortable following her lead now.
Yeah, following quite quickly here, Heather. Alberta, Saskatchewan, the latest provinces to say they're looking at the BC protocol. PEI already announcing that it too will be delaying the second dose of the vaccine for people under the age of 80. Take a listen to what we've heard right across the country.
We'll be announcing it soon, but we will be looking at having that length of time between first and second extended.
We're looking at data, from other provinces. We're looking forward to NACI recommendations.
We anticipate the second doses will not be required for 3 or 4 months.
And while we are awaiting an update from Ontario, a reminder, take a look at this board. This is what was issued by both the province's health minister and solicitor general on Monday. They were essentially saying that they are right now consulting federal officials and, quote, with the goal of pursuing a similar direction to British Columbia. And even this country's deputy chief public health officer, Dr. Howard New, well, he says the real world data that officials are now collecting is encouraging. Remembering here, Heather, that Dr. Henry says a single dose is showing a 90% efficacy against the disease, with a protection that lasts for months.
Michael, thank you very much.